So presenting today is Dr. Kathleen Stevens. She's an assistant professor at Munn Faculty of Nursing, and she has taught nursing education for 24 years. Her clinical background includes community health, the NICU, and advanced foot care. Her primary research interest is in foot care, but she's also interested in positively impacting government policy related to the provision of foot care services for individuals at risk for poor foot health, and that's so that they can maintain independence and quality of life. Our co-presenter is Jennifer Densmore. She is a nurse educator at the Center for Nursing Studies, and she has taught nursing education for 9 years. Her clinical background includes orthopedics, neurosurgery, neurology, community health, and advanced foot care. And her research interests also include foot health, but in addition, simulation and peer mentorship.
So for our presentation today, we're going to talk a little bit and define advanced nursing foot care. We're going to give you an overview of the development of the Canadian Association of Foot Care Nurses, and you'll hear us refer to that as the CAFCAN. And we'll also be talking about the CAFCAN competency document. We'll provide you with an overview of practices for advanced foot care nurses in Canada, and we'll discuss how to apply the document in practice. So we've come a long way. So before 1985, there was little evidence of formal education programs or guidelines for nursing foot care. And even when these programs did start to come about, there was a lot of inconsistencies related to the education and training. There was minimal standards and guidelines, especially in relation to infection control guidelines. I remember when I first did my foot care course a long time ago, we received very little discussion about sterilization, and we certainly see, as you will see later on in the presentation, we have come a long way. So it's like with anything with nursing, we do research, we talk to other nurses and that, and we do come up with best practices and things like that. And there were some provincial standards and guidelines set forth, but nothing like we see today. And so, as you'll hear us say quite a bit throughout this presentation, we have come leaps and bounds in terms of the development of advanced foot care nursing in Canada. So, bring us forth to today, we have this definition of advanced foot care nurse. It's a regulated professional who has received additional education specific to the foot and lower limb. So we're now provided, and the nurse must hold a registration with their professional regulatory body. So here we are now with a very, we had a very loose definition of what an advanced foot care nurse is, and now we have specifics. So this definition really highlights the education required to be an advanced foot care nurse and the responsibility that being a foot care nurse, an advanced foot care nurse holds. We now see that the education includes things more than just stopping at the ankle, which I'll get into in the next slide. So a foot care nurse has a complete understanding of the structure and function of the foot. A lot of health assessment courses you'll see will stop at the ankle. We don't talk much about the joints in the foot, the pedal pulses and things like that. So we're seeing that now in our education programs. In the advanced foot care nurse has a knowledge and understanding of how diseases such as diabetes and other chronic illnesses can affect the foot and the complications that do arise in the feet due to these things. We also pay attention to the medications that people are on and the impact that this has on their feet. We're following strict infection control standards in terms of cleaning and sterilizing our equipment. We are now recommending, and it is considered best practice, to use an autoclave. We're aware of health and safety while providing foot care. This means, wearing appropriate PPE, proper instrument disposal. Now with COVID-19, screening before we go to people's homes or having them come to our clinics for advanced foot care. we work closely with other healthcare professionals and make the appropriate referrals. And for anyone that saw our presentation last week, you'll see that in our study, it showed that advanced field care nurses are working a lot with community health nurses, with family physicians, and wound care specialists. So that's great. The foot care nurse participates in educational opportunities to maintain and enhance competencies. So the CAFCN does have a conference every year. It's great for networking. There's lots of educational sessions brought forth. It's great for that. The foot care Nurses Special Interest Group here in Newfoundland, we do have education days. We've had morning coffees, and if you're on our email distribution list, any sessions that we see that are free, especially from Quality Foot Care Products and other organizations, we do send it out to our members, and they are great sessions on fungal nails, autoclaving, and things like that. And most of all, we're responsible for our actions as foot care nurses. So, between 1985 and 2002, formal foot care began to emerge. So courses were traditionally called basic, advanced, basic foot care, advanced foot care, and diabetic foot care. And you know, the basic foot care, people thought that foot care nurses were just going to come in, cut your toenails, and put some nail polish on, and that would be it. But in 2005 to 2010, we started to see more of an effort being made to establish national guidelines and a certification process for advanced foot care nurses. And we saw that Foot Care Nurses Network in Ontario was developed at that time. So in 2007, Foot Care Canada was formed. In 2008, there was a plan to have a national communication strategy formed regarding advanced foot care nursing. A position statement was formalized. It included a mission statement, the goals, and the organizational structure. And this group became known as the CAFCN in 2010, and that is what it remains today. So, what is the CAFCN? The Canadian Association of Advanced Foot Care Nurses is an organization formed by practicing foot care nurses across Canada. It is a dynamic, growing community of nursing professionals who are providing advanced foot care and who are dedicated to advancing the practice of foot care. This collaboration, education, and networking opportunities. And as I said, when we do go to those conferences, there is a lot of networking, a lot of education, and a lot of collaboration that goes on. And you end up leaving feeling so empowered as an advanced foot care nurse. So the mission of the Canadian Association of Advanced Foot Care Nurses is to advance the practice of foot care through a collaborative and networking process for all individuals involving foot care, providing foot care. So what are the goals of the CAFCN? They want to collaborate with healthcare professionals across Canada to promote optimal care and improve client health outcomes. So they do have provincial advisors, and myself and Kathleen are provincial advisors here for Newfoundland. And we do have meetings quite regularly where we sit down and talk. We talk about our interactions with healthcare professionals in our provinces, and we network and talk about how we're going to improve the foot health of our clients. They develop national guidelines and certification process for advanced foot care nursing, and they do have great educational opportunities. The CAFCN provides public awareness of the benefits of foot health and the role of a foot care nurse within the healthcare team. And we're finding that that is beginning to become more of an area which we have seen improvement, and people are starting to realize what the role of the advanced foot care nurse is and what exactly it is that advanced foot care nurses do. The CAFCN hopes to facilitate the development and publication of clinical and research-based articles related to the advancement of nursing foot care. So this here is the organizational chart. So as you can see, there is a president. The past president also sits on the executive, a vice president, a secretary, and a treasurer or membership chair. And then the country is divided into three sections. We have Western Canada, Central Canada, and Eastern Canada. And obviously myself and Kathleen have a lot to do with the Eastern part of the organization, but we do all meet together throughout the year. So CAFCN does have a membership. What are the benefits of membership. I can speak about this for hours. So it supports the goals of its members. It produces and gives you access to published information regarding the relevance of foot care nursing in Canada. There's peer networking opportunities, professional development session. There's plenty of opportunities to get involved. There always is something for somebody to do. It's a safe place and venue for sharing perspective, experience, and practice resources. This is a place where issues of national, provincial, and territorial importance are discussed. And we are at CFCN act as a common voice to government. So, the CFCN is a unified voice to bring common issues to the attention of government. And they also attempt to work with government to provide viable solutions. So there is a CAFCN website. This here is the website address. You can sign up for membership, and there are all kinds of fantastic resources there. We currently have fourth-year nursing students at the Centre for Nursing Studies doing a project related to foot health among children, which I am really passionate about. And I didn't realize there was a need until Kathleen and I attended a little terrific scientific, it was called, at the farmers market. And all the children were coming in looking for me to tell their parents that they're not cutting their toenails correctly. So believe it or not, there was a lot of information to pass on in education. I'm going to pass it over to Kathleen now.
Thanks, Jennifer. So I'm just going to build on what Jennifer has presented. And so we're going to take a closer look now at the CFACN competency document, which reflects best practices for advanced foot care nurses. And so one of the primary initiatives that CFACN has undertaken is the development of this document. So in 2017, it was published, and the competencies were developed after an extensive consultation process with nurses and key stakeholders across Canada. In 2018, Jennifer and I conducted the survey research that we presented last week, and one of the questions we asked was, has the CFACN competency document been helpful to you in your practice? So it was only out for a year at that point, so over 80% of respondents indicated that it was helpful, and at that point over 45% said that they referenced this document in their policy. So it would be really interesting to go back now and see if that has increased. And so just a couple of qualitative comments that they had about this document. It provides a quick guide to best practice. Another comment, it speaks to all foot care nurses and gives us a foundation, encourages understanding, and is a great reference. So a goal of CFCN would be that all foot care nurses would use this document to guide their practice. The association does recognize that for some nurses, this document means a large change in practice for those who have been established in their practice and in their business, and so it may take some time for them to integrate these competencies. And by a large change, I mean in relation to what they are doing now, and then the new education that they may need to meet these competencies. So there are 7 competencies with multiple indicators, and so this afternoon we'd like to unpack that for you and provide exemplars of the competency and how foot care nurses are applying that competency to their practice in Canada. So purpose of the competency, so the overall goal of the competency is the provision of safe, ethical, and competent care. And the competencies describe the knowledge, skills, and attitudes, as well as the judgments needed for advanced foot care nurses to achieve this goal of providing that safe, ethical, and competent care. So really the competencies address 3 needs, and so they provide consistent guidelines for the development of education programs. They provide clarity in relation to the care advanced foot care nurses provide, and this is really important for patients, for families, and healthcare providers and policymakers. And 3, the competencies also provide a framework for research and areas to address in relation to research, and this in turn, of course, will support evidence-informed practice and decision-making. So here's a model that shows the competencies, and so our framework was adapted from a client-centered framework approach, which is used by nurses and other healthcare professionals. And so as you can see, the client is at the center, and the framework organizes the competencies into 7 domains. And advanced nursing folk care is viewed within the general framework of nursing, so you see that as the outer circle. So nurses meet the standards and competencies for their professional designation in addition to the competencies for advanced folk care nursing. So the first competency is knowledge-based practice, theory, and application. So nurses engage in the specialty of advanced nursing foot care in Canada, collaborate on, develop, promote, and facilitate best practice for client-centered health. Further enhancing their nursing knowledge base, advanced foot care nurses integrate a specialized body of knowledge of lower limb and foot health into their daily practice. And so just to look at, and there are many indicators actually for this one, and so I'm just showing you a selection here. And that falls under this competency or domain. So just taking a deeper dive, let's consider number 9, 10, and 11, and a specific exemplar for these indicators. So the indicators explain the principles of infection prevention and control as they relate to foot care practice, instruments, and equipment, have knowledge of the safe use, care, and maintenance of critical and non-critical instruments for foot care, and maintain currency in reprocessing medical devices, reprocessing standards and guidelines specific to foot care. And so since I completed the advanced foot care course in 2008, and Jennifer had discussed this as well, there's certainly been a significant change in best practice related to infection control and instruments. And so at that time, we were using accelerated hydrogen peroxide, and that was considered to be best practice. And now we promote autoclaving, steam sterilization as best practice, or the use of disposable one-time instrument sterile packs that cost about $10. So in relation to that, so these, Jennifer and I get, the reason why I chose those 3 is we get a lot of questions about this one in particular, and so these are the 2 documents, this position statement and another IPAC document that we will always refer nurses to. And so, and these are the documents that are promoted by CFACN in relation to reprocessing of critical foot care devices. And so in the new year, we're actually going to be having a webinar that will be hosted by the Foot Care Interest Group, so our special interest group, in relation to these documents, and Merle Steele Broadway will be presenting from IPAC. So it's this one, the position statement and practice recommendations for infection prevention and control related to foot care in healthcare settings. So they're available on the website, and if you need any help finding them, certainly just let us know. So the second competency is risk assessment and health promotion. And so advanced foot care nurses are committed to providing safe care to clients and to promote the health of each individual client. They use critical thinking, clinical judgment to identify potential risks and act to prevent negative health outcomes for the client. We educate clients to assist them in managing and averting risk to the lower limb health. And so the indicators for this particular competency, you can see there. And but I would like to highlight number 6, reduce risks and promote health by implementing client-centered teaching and resources. And I guess as an educator, I'd just like to proudly show this. This was actually 2 infographics that were developed by 4th-year students last year at the Center for Nursing Studies in their community health nursing course, where they were assigned an aggregate, and their aggregate was CFACN. And so the group of students developed this infographic, one for general foot health and one for as well for diabetes and foot health. And so this is the next one that they developed. And so this group, there is also, I think, a group this year that is working with CFACN again. And so they're developing, I think Jennifer, you had shared with me about a education related to foot health for children. Just as Jennifer said, we had identified when we had participated in the health fair. So I'm really looking forward to see what they develop there. And so these will be the type of resources we would have in relation to promoting foot health. And of course, Diabetes Canada also has some downloadables that you can use to hand out to clients as well. So number 3 is quality practice. And so we participate in processes to promote quality practice, engage in reflexive practice, policy development, implementation of evidence-informed care. We're committed to continuous quality improvement in advanced nursing foot care. And so here are the indicators here, and I just like to highlight number 3 there, develop practice tools. And so, and share this tool with you. And so this exemplar shows a tool that was developed by nurses in Alberta, Chelsea Krause and Lori Ralph. And so at the beginning of the pandemic, many foot care nurses were being asked to visit clients for foot care, but they had no way of establishing whether the requested foot care was of low or urgent risk. And at that time, if you remember, there was a shortage and rationing of PPE as well. We were working within government guidelines, triaging client foot care became the norm. So these 2 foot care nurses developed this tool to assist in providing a starting framework for establishing a score to determine the acuity of clients. And so, you know, this isn't a validated tool. It is a framework. And so, you know, nurses, if they are using the tools, should certainly still rely on their own assessment and skills, but it does provide some guidance. So this, I think, shows clearly this particular competency of quality practice. The next one is professional communication and relationship, and we provide care to clients in the context of a professional, therapeutic, business communications and relationships. They're conscious of maintaining boundaries in those relationships in every context of care to protect clients from potential harm or exploitation. So all of these, I guess, indicators that you see there tie into the client teaching that I just talked about. As well, I'd like to highlight here that many advanced foot care nurses are nurse entrepreneurs as well. So their care is also delivered in the context of a business relationship while maintaining a therapeutic relationship. And I think this competency addresses that. So number 5 is coordination and collaboration. And so we're conscious of the need to coordinate care for our clients through collaborative networks and relationships which promote the lower limb and holistic health of each individual client. And so for this competency, I'd like to highlight the first indicator that you see there. So communicate the roles and responsibilities of advanced nursing foot care to stakeholders and members of the health team. The exemplar I'd like to share related to this indicator is a recently released collaborative document with the CRNNL and CLPN, and I think Wanda Lee is here today, and to also have a chat about that after our presentation. And so here is the document, and so Jennifer and I consulted read this document and availed of the opportunity to communicate the roles and responsibilities we have as advanced foot care nurses. And we provided feedback, and this document was sent out for feedback as well. And so this particular practice guideline outlines practice expectations for RNs, LPNs, and nurse practitioners whose practice includes advanced foot care. So on to the 6th competency, which is the category or domain of advocacy. And so advanced foot care nurses seek to advance the practice of nursing foot care and to make advanced nursing foot care services accessible to all Canadians. They use their influence to support clients in advancing their health and to advocate for evidence-informed practice. So this one is one that, as Peggy, when she introduced me, talked about, I really want to influence policy. So this one has a lot of meaning for me. And I can provide many exemplars of this particular competency. For example, for number 1, the first indicator that you see there, the CFCAN recently released a pamphlet educating the public about the role of advanced foot care nurses, and Jennifer shared the definition from that pamphlet with you at the beginning of the presentation. And for number 4, which is enhance the evidence base of by participating and contributing to research. And so Jennifer and I shared our research with you last week, and we have several ideas for some next steps to build on that research, and we certainly appreciate the support we receive from CFACN in relation to conducting that study. And then number 7, you can see there, the indicator refers to participating in professional development activities. And so at the provincial level, we have the footcare nurses special interest group, where we've had yearly education events over the last several years. We certainly have enjoyed those and the opportunity to see nurses from across the province. And we hope to resume them in 2021. And we're going to be offering some online education in the new year. And of course, Jennifer mentioned the conference, and I can't promote that enough as an opportunity to network with other nurses and disciplines that are focused on foot health, as well as businesses. And lastly, we have ethical practice. And so we're aware of the particular ethical challenges in our practice. We're committed to protecting the public and providing services in an environment of safe, competent, evidence-informed clinical and business practices. So for this particular one, the indicators that you see there, that several of these indicators to running a business. So example number 4 and 5 is focused on the fee charged by advanced footcare nurses, and number 5 is focused on the potential conflicts of interest that can occur when you're running an advanced footcare nursing business. So I hope this provides you with, I guess, a snapshot of best practices for advanced footcare nurses that we are accountable to follow. And if you have any questions related to any of the competencies, or that you would like to discuss best practice, if you are a footcare nurse, then please don't hesitate to reach out to either myself or Jennifer. We'd be happy to chat with you and meet with you. So in closing, these statistics that you see there really reflect that foot health needs are a significant health concern. You know, the Australian study that I quote there, and I quoted that last week as well. So very similar healthcare system to ours, where 1 in 13 admissions were related to foot disease or trauma for individuals who were mostly above 40. And then contributing to foot health as a significant concern is our aging population in our province and the number of people with chronic disease. And as you can see from this slide, the cost of poor foot health is great. It's great for people, it's a high cost to families, and then it's a high financial cost to our healthcare system. And so footcare nurses want to change these statistics. We know by following these competencies, we can make a difference and positively impact foot health across the lifespan in our province and in our country. So to summarize, I guess 3 key messages that Jennifer and I wanted to leave with you today is that foot health needs are significant, and as footcare nurses, we play a vital role in supporting the foot health of all Canadians. The CFACN competency document outlines those best practices, and as self-regulated health professionals, advanced footcare nurses are accountable to follow best practice recommendations.